In pancreatic cancer patients, many of us know that this is a very deadly disease, and patients, even after surgical resection, unfortunately have recurrence of their disease. So this was a very important trial because what they were looking at gemcitabine and nab-paclitaxel versus gemcitabine in patients that had surgically resected pancreatic cancer. And this is really building upon the data that was actually presented last year with the FOLFIRINOX trial that showed that FOLFIRINOX was actually better than gemcitabine. So in this clinical trial, 866 patients were randomized after surgical resection. They were stratified according to resection status, lymph node status, and a couple of other. What they basically showed was that the patients that got gemcitabine and nab-paclitaxel chemotherapy, it unfortunately did not meet its primary endpoint of centrally reviewed disease-free survival. But they did have some other interesting results when you actually looked at investigator analysis of disease-free survival, as well as also overall survival, which is still immature. So this was a very unique trial because this is the first trial to actually use centrally reviewed disease-free survival as a primary endpoint. So the investigators really wanted to try to add an additional layer of rigor to their primary endpoint. And it was kind of interesting because what they showed in terms of the results was that for the investigator reviewed disease-free survival, for the group that got gemcitabine and nab-paclitaxel, that was about 19.4 months. And then for the group that got gemcitabine, it was about 18.8 months. And why is that interesting? Well, number one, the gemcitabine group was doing a lot better than we had expected. And I think that there's some challenges with having a central view as a primary endpoint because you cannot really put together a lot of the other clinical aspects of how the patient is actually doing. So I think there's more to come with the data as it gets more mature, but at least from the primary endpoint of centrally reviewed disease-free survival, it did not meet that metric. In addition, in the APACT trial, they also looked at investigator analyzed disease-free survival. And there it was actually kind of interesting because from the investigator point of view, the average disease-free survival was a little bit over 16 months, about 16.6. And for the gemcitabine arm, it was about a little bit over 13. That kind of corresponds more with like what we saw with the SPEC4 trial. And I think this is going to be really interesting because right now we only have about 48% of the data analyzed. It's going to be interesting to see how that overall survival really kind of pans out on the APACT trial. Because at least in the metastatic setting, we know that gemcitabine and nab-paclitaxel and FOLFIRINOX both are effective. And I think that, when we start following these patients out longer in the APACT trial, we might start seeing that, in terms of overall survival, which is a very important, metric in our patients with pancreatic cancer, there may still be a benefit with that regimen. But we still need to actually wait for the data to mature.